Hello everybody and welcome to Species Specifics. Today we're going to be doing a short presentation on chinchillas. If you are new to this series, the goal of these lectures is to cover unique diseases of different veterinary species that are specifically mentioned in the ICVA NAVLE study guide. I have also included some diseases that are not mentioned specifically but may come up during your studying. The focus of these lectures is on disease recognition through images, clinical signs, and diagnostic tests. I have also highlighted key, easily recognizable characteristics in bold. There are only a few notable diseases to remember about chinchillas for the NAVLE, so I have put them in no particular order. We will start with choking. Chinchillas are not able to vomit, however, they may ingest objects like bedding or treats that are too large for them to swallow. In a choking chinchilla, you may see clinical signs like pawing at their mouth, drooling, and retching. You can usually diagnose choke through radiographs or by palpating the obstructed material. Dental malocclusion is common in our pocket pet species, and chinchillas are no exception. Malocclusion can affect the incisors, premolars, or molars. In chinchillas, dental malocclusion typically arises due to having a lack of hard items for them to chew on. Signs may include weight loss, drooling, and halitosis. We can treat this condition by trimming the teeth. Hair rings are loops of hair that can become wrapped around the penis of male chinchillas. This can cause irritation and infection if left untreated. Clinical signs include excessive grooming behavior focused around the prepuce and straining to urinate. Treatment involves removing the ring gently, often using lubrication. Fur slip is a normal feature of chinchillas, where they are able to release patches of fur when they are frightened or stressed. These areas then appear as completely hairless areas, with no other changes to the skin. Treatment simply involves waiting for the hair to regrow and keeping the chinchilla in a quiet environment with gentle handling practices to help prevent further fur slip incidents. Chinchillas are highly susceptible to Pseudomonas, which can cause a variety of infections in this species. Common infections include enteritis, conjunctivitis, pneumonia, otitis media, and skin infections. Basically, if you have an infection in a chinchilla, you are pretty much safe to use Pseudomonas as a differential. Treatment for this condition involves antibiotics. Fighting chinchillas can cause severe damage to each other, especially when female chinchillas fight with unsuitable mates. These bite wounds can commonly develop abscesses from Streptococcus or Staphylococcus, requiring antibiotic treatment. Finally, limb fractures are common in chinchillas because their limb bones are very fragile and thin. This is particularly true of their tibias, where most limb fractures occur. Chinchillas can develop a limb fracture from getting their leg caught in a wire cage or from improper handling. Treatment is similar to other species, but note that it can be hard to stabilize their tiny little legs for proper healing. Thank you for watching Species Specifics. If you enjoyed this video, remember to like, subscribe, and share with your classmates. Thanks again for watching, and we will see you in the next video.